understand that these are sort of in 3-dimension. So this is for balance, positioning. This is for hearing. Cochlea. This is the bringing in the messages. So how does hearing happen? Hearing happens because of sound waves are directed into our ear. That's what the auricle does. Helps to direct it to the external canal. And they hit this membrane here, the tympanic membrane. The tympanic membrane then bounces that signal off of this bone to this bone to this bone. 3 smallest bones in the body, the ossicles, or the ossicular chain. They're the 3 smallest bones in the body. They're the malleus, the incus, and the stapes. You can see it right there. Also known as the ossicles or the ossicular chain. That information is then transmitted to the vestibule, where it travels through two types of fluids. In the cochlea, there are these little tiny hair-like filaments that are suspended partially in a gel-like matrix, partially in this fluid. And when these little hair-like filaments get that sound vibration that has come in from the outside, they get this little vibration that they take, collect all that information, and bring it to the vestibular cochlear nerve, also known as cranial nerve 8, which takes it to the part of the brain where we interpret sound. What lobe of the cerebrum? Temporal. Good. And that's how we hear things, and that's how you're hearing what I'm saying right now. Which means if somebody can't hear, it could be a problem here, 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 or here, or of course, in the brain. A lot of things go wrong. All right, so let's do. Oh, somebody once told me, one of my students once said, the way they remembered cranial nerve 8 was for hearing was because 8 begins with an E, and ear begins with an E. So that was the clue that they always used, and I thought that was pretty good. It worked for them, so I always include that. Cranial nerve 8 with an E is for hearing, the ear. If you were just learning these a little bit as you go along, it will help. Okay. There's extra auditory meatus. We talked about that. The cerumen from the ceruminous glands. The cerumen's the earwax. The tympanic membrane. The ossicles. Okay. The malleus is the hammer. The incus is the anvil, and the stapes are the stirrups. The ossicles can amplify sound up to 22 times the original level, which is pretty good. Here's the cochlea. Realize that those little tiny filaments that are embedded here are very fragile. So if they're vibrating at such a rate that they snap off, or part of them snaps off, that means that the person is not going to have the sensitive hearing in that ear. This is why when you go to the airport and you see people working on the airplanes, they wear the big ear protectors, the big ear muffs, because if those little filaments get damaged, they're gone forever. This is why you should not be wearing your earbuds in your ear for your iPads or iPhones or iPods or whatever, listening to music for more than an hour a day, and you should never have the volume turned all the way up. What do people do? The eustachian tube allows for pressure on either side of the eardrum to be equalized. This connects to the pharynx, the throat. There's the tympanic membrane. Oval window, that's part of the vestibule. The labyrinth. You do want to know this as the labyrinth. Because you'll hear about something called labyrinthitis. Okay. Cochlea, we talked about that. There's two different fluids, perilymph and endolymph. Sound waves entering the external canal vibrate the eardrum tympanic membrane, process called sound conduction. The middle ear then amplifies the sound in the ossicles, called bone conduction. The last ossicle, stapes, vibrates, causes a gentle pumping against the oval window membrane. This causes cochlear fluid to vibrate small hair-like neurons found in an area called the organ of corti. Organ of corti. A nerve impulse is sent to the temporal lobe of the brain. We know that interpreted as sensorineural conduction. Organ of corti. Good trivia question. Here are the semicircular canals for balance. Fluid inside, little tiny sensors. There's a good image. A little bit better.
So what happens if somebody has vertigo?
That is the result of some sort of inflammatory process of the semicircular canal. Yeah. If it is an acute process. You know what vertigo? Everybody know what vertigo is? Vertigo is that sensation of moving when you're not. You're actually standing still. It sucks. Bed spins.
That's something else.
If it is more chronic, something called Meniere's disease. Have you heard of this?
No.
Meniere's disease is more of a chronic inflammation, but it can be caused by trauma. Where you have a patient has vertigo as a result of damage to the semicircular canals. Yeah. But you'll hear people refer to it as labyrinthitis when they have an acute vertigo as a result of an inflammatory process. Labyrinthitis. When you talk about tinnitus, the tinnitus, whichever pronunciation you go by. Tinnitus is that ringing sound you hear. Some people still pronounce it. You'll hear the pronunciation tinnitus also, but most people pronounce it tinnitus. It's a ringing or buzzing sound in the ear that nobody else can hear. If everybody else can hear it, then it's a phone. But if just you're hearing it, well, tinnitus. Yes.
I was going to ask about.
That's my ESP. See, it does exist. Deja vu. All right. Sense of taste is referred to as the gustatory sense. Tongue is covered by the papillae, which of course is what we have on the taste buds. These are just the signal gatherers. They're just getting the information. Does something taste sweet? Does it taste salty? Does it taste bitter? Or does it just taste yummy? Taste buds detect 5 tastes: sweet, sour, salty, bitter, and umami, or just called yummy.
Yummy.
Yes, umami is is the taste of deliciousness. Are we getting to lunch yet? Are we getting close to lunch? Getting there. I could go for something umami right now.
Got that craving?
I do, actually. Distinct taste of glutamate. So those are the excitatory aminos. That's good stuff. Taste preferences may change with the body's need, which is why pregnant women eat dirt. They will eat all kind of crazy things. Pecan, but that's true of a lot of people. Have a craving for things like laundry detergent or chalk, ashes from an ashtray, common cornmeal. No.
Strange addiction?
Yeah, you will, if you're in this long enough, you will meet people who eat laundry detergent. All right. It does, actually. Smell like a Carolina pine forest. Yeah, don't, boys and girls, don't eat laundry detergent, please. Unless it's, that's terrible. I wonder if I'd get a little kickback though. Because, you know, I do use Tide and it keeps my clothes looking clean.
It's great for sweater vests.
It is great for sweater vests. It's great for everything. Umami. What?
Sweater vest. Was there like a sweater vest fire or something the other day? 2 days in a row.
I can't, you know, I can't bring that to you every day. I would like to, but quite frankly not allowed. That's why we only have 3 days a week, right? It would be overload. Okay. Things you smell. Olfactory region. Remember if you think back to the skull, there is that bone that goes from here to here all the way across. The sphenoid. Part of the sphenoid bone has the area called the cribriform plate, which is where it's little perforations that will allow for the nerves, the sense of smell to go down and go into our nose. We talked about how it's linked to memory and such. Oh, there you see it. Okay, the olfactory bulb right above the cribriform plate. Sphenoid bone. These little bony projections are called the turbinates. Do we talk about these? No. Inside the nasal cavity, there are these little bony projections called turbinates, and they're simply named superior, middle, and inferior, very easy. And they're lined with a little bit of a mucous membrane. And it's important because when you breathe in through your nose, that air doesn't just go straight back down into your lungs. When we breathe in through our nose, that air actually gets whipped up and around the turbinates first, and then down. And the reason for that is because our lungs are a very warm and moist environment, so we want the air going into our lungs to be warm and moist as well. By whipping the air across here, it gives the body a little bit of time to add some heat to that air, for the air to pick up some warmth. And of course, by having mucous membranes here, it allows the air to pick up some moisture. So that's the idea. So the turbinates are kind of important for that. Touch receptors, small rounded bodies we call corpuscles located in the skin, especially concentrated, not surprisingly, in areas where we have to have very fine feeling, fingertips, tongue. Temperature sensor is also located in the skin, not surprisingly. Our skin is what is going to really help regulate temperature. Adaptation occurs when sensory stimulation is continually applied. Therefore, it doesn't feel as cold anymore, it doesn't feel as hot anymore, you don't feel the sweater you're wearing anymore, etc. Heat and cold therapy. Heat relaxes muscles, dilates blood vessels. Cold constricts blood vessels, minimizes amount of bleeding and swelling at the site. This is why when somebody first gets injured, we say, put ice on it first. You put ice on it, because when cells get injured, what do?
Call for help.
They call for help. And then who comes?
Everyone.
Everybody. And we call that
Inflammation.
inflammation. And then what follows inflammation?
Swelling.
Swelling, edema, fluid. So where's that swelling, edema, fluid come from?
Blood vessels.
It comes from blood, right? So if we want to bring less blood to that area, what are we going to do? Constrict the blood vessels. That's why we're going to put ice on there. After about 24 hours or so, after the healing process has started, the inflammation has gone down. Now we want to flush out all of that garbage that is collected there. If we want to flush out all the garbage that's collected there, we are going to vasodilate, which is why we say put what on it? Heat. We want to get those blood vessels nice and big and bring some fluid there and flush that garbage away. Remember, the solution to pollution is dilution.
Question.
Yes.
We talk about vasoconstriction and vasodilation a lot. Do those also affect arterial contractility or changes as well, or is it mostly active on the venous side?
No, arterial.
Okay.
Absolutely.
Okay.
Yeah.
It just happens to be referred to as vaso.
Yeah.
Okay.
Vaso is as in the form of vessel.
So vaso's vessel, not.
Yeah.
For some reason, I was associated with venous.
That's right. What about pain? What do we know about pain?
It hurts.
Pain hurts. Our body's way of making us pay attention to bad things. This is an important concept, because when you get cut on the bottom of your foot, how do you walk? Like this? Why do you walk like this with your foot up off of the ground? Because you don't want to make it hurt more. That's why you do that, right? That's why we do that. When we get cut on the bottom of our foot, we walk like that because we don't want it to hurt more. Because when we walk on it, it hurts more. Well, what's the real reason we don't want to walk on it? You might not be aware of it, but what's the real reason our body doesn't want us to walk on it?
Prevent further injury.
Prevent further injury and what? And so it can heal. Absolutely both of those. Prevent further injury in the form of additional tearing, additional infectious agents getting pushed up into it, and allowing it the opportunity for that tissue to come together and heal. That's really why we don't want to walk on it. We just don't know that. We're too stupid to know that. Instead, we get, hey, it hurts if you walk on it, so I just want to walk on it. Does that make sense? This is a big concept. When it comes to our diabetic patients, this is a big deal. Pain's important for that. We're not really that stupid. Yes, we are. Yeah. You're not, I am. The rest of you guys are brilliant.
Why is it important to diabetic patients?
No. Yes and no. No and yes. I don't know. Yeah, you did miss some. No, you didn't miss anything. We will get to it. It is important. I haven't told you yet why. I know. Now it's killing me because I really want to tell you. That's good stuff. Oh, we talked about diabetes. You guys, you know, a lot of people think they know diabetes. They know about diabetes. They know about this. Sugars. Yeah, they got the sugar. Doctor told me I have sugar. I bet. Me too. What time do you want to break for mommy today? Is it? Pain is the most widely distributed sense, being found most everywhere. Pain receptors are branches of nerve fibers called free nerve endings. Pain receptors do not adapt. You feel pain as long as the stimulus is there. Pain threshold appears to vary among patients, not surprisingly. Women have a higher threshold for pain than men do. This is not a myth. This is actually something that's been scientifically proven. Kind of makes sense. I've seen women giving birth. I told you this. See women giving birth going, oh, this really hurts. This is really uncomfortable. Really? That's all you got? Referred pain. Here are pictures of pictures of referred pain. We know that referred pain from the heart can also be felt in the arm, sometimes in the neck, sometimes in the back. We know. I'm sorry.
The gastric area also.
Gastric area also. Appendicitis. Not surprisingly, it could be found around the appendix. It actually usually starts out around the umbilicus. Do you know that? Pain of appendicitis usually starts out around the umbilicus, and then later moves here. And then, of course, when it is felt, how's it felt? On rebound, right? You know that? Okay. So, gallbladder can even be found up. Oh, there it is. I can see up around the shoulder and such. Phantom pain. Are you familiar with this? Someone loses a limb, body part, they still feel sensation. They still feel pain in that area, even though it does not exist. I think you can figure out what these are. Analgesics are medication help to alleviate pain. Pain is subjective. It is often difficult to assess because they're often lying. NSAIDs are used to treat mild to moderate pain. Remember, when we want, when the cell's damaged, when the tissue's damaged, it sends out a call for help, an inflammatory response. What comes with inflammation is swelling. Swelling then causes compression, causes pain as it presses on nerves. If we get rid of the fluid, we'll get rid of the pain, but that's only temporary. So a better way to get rid of the fluid is get rid of the inflammation. So a good way to get rid of pain is by getting rid of inflammation. And we can get rid of inflammation using corticosteroids. Corticosteroids are great for getting rid of inflammation and thereby getting rid of pain. Corticosteroids work very, very well for getting rid of inflammation and thereby getting rid of pain. And that's true of anywhere, whether you're talking about an inflammatory process around the nerves in the back or a rash on the skin. It doesn't make a difference. However, if you want to stop the inflammatory process, but you want to use a drug that is not a steroid, then you can use one of these, a non-steroidal anti-inflammatory drug. That's what NSAID stands for. That includes things like naproxen, ibuprofen, ibuprofen. Opioid analgesics are used to treat moderate to severe pain. That's the big guns. Conjunctivitis is an itis. This is from those kids, thank you very much, full of pink eye and pinworms. I'm sorry? Watch what?
You got that
Wash
all
your
over.
hands after you touch them.
Oh yeah. Oh, I did more than just wash them. Set fire to them. Conjunctivitis is an itis of the conjunctiva. Now here's the thing. It used to be, we know that conjunctivitis is going to be caused by something. It doesn't have to be a pathogen, because anything that can cause an inflammatory response on the conjunctiva could be considered conjunctivitis, right? We understand this. But the most common reason for conjunctivitis is one of two. Viral or bacteria. Old school will tell you that a contagious bacterial conjunctivitis is what was called pink eye. And that viral conjunctivitis is called viral conjunctivitis. You'll hear old doctors still say things like this. But the reality is now we just call all of it pink eye conjunctivitis. It doesn't make a difference. If it's in one eye, and it's bacterial or viral, it's only a matter of time before it gets to the other eye. And that's going to be either cross-contamination, simply doing something like this, you know, the kids poking themselves in the eye all the time. Or, remember, the lacrimal duct drains down into the nose, which of course is connected to the pharynx, which of course is connected to the nasal lacrimal duct on the other side, which of course is connected to the eye. So it could just make that travel this way as well. So you can call it pink eye either way. Cataract, we talked about this, clouding of the lens, lead to blindness. Cataract surgery is one of the earliest surgical procedures dating back to ancient Greece. Basically, all they do is get a little metal pin or needle, or like a long needle, and just do a little stick into there and release the pressure a little bit, and the clouding would just go away. The person will be able to see again. Pretty brilliant. Glaucoma, we've talked about this. Glaucoma is a result of that intraocular pressure because our aqueous humor did not sufficiently flow through our canal of Schlemm. Hyperopia. Very easy to describe hyperopia. Hyperopia is when the person reads the menu like this. Myopia is when the person reads the menu like this. Farsighted, they can see things far away. Hyperopia. Myopia, they can see things close up. Rather than going through the long, incredibly boring descriptions that a lot of these books have, that's all you need to know. Presbyopia, farsightedness that occurs with age. You can see better. It's again, but that is one that, what's the word I'm looking for? It's new, I guess. That's what I'm saying. Myopia, we just talked about this. This one's a little different. Amblyopia, also called lazy eye. Here's the thing about amblyopia. It should be called lazy brain, not lazy eye. A lot of people, when they think of lazy eye, they think of that person who has an eye, one eye that's pointing straight ahead this way, and the other eye that's drifting off to the side, going one direction or the other. When in fact, it's not a lazy eye that's doing that. It's muscle that's pulling it too hard one way or not hard enough the other way. Well, that's called strabismus, by the way. And when a person has this, and they're looking at you, and their one eye is looking straight at you like it should be, and the other eye is looking down over here.
Which is that?
When this happens, this person's brain has been conditioned to only accept and pay attention to the information that's coming in from their good eye. Because their brain is thinking, well, I'm looking at this person, I only want to look at them, I don't care what's happening over here, so I'm going to ignore that information. The ignoring the information part that's happening in the brain, that's the amblyopia. The strabismus is the physical part of the one eye going this way, one eye going this way. The fact that the brain says, I'm not going to pay attention to what's coming in this way, that's the amblyopia. Now it's interesting, when that's surgically corrected, and it usually takes more than one surgery, it usually takes multiple surgeries. But what happens though, when they bring these two eyes back so they're both where they're in center where they need to be, the brain will continue to ignore what's coming in this eye, because it has for so long. So what they'll do is they'll put a patch on the good eye, and then the other eye will be forced to sort of, the brain will of course take the information in from the other eye. Kind of interesting. There's another one that's not on here. I thought it was in the book though. Color blindness, have you heard of this? Does color blindness affect men or women or both?
Men.
Men mostly. Yeah. It can affect women, but it's much less common, but it does affect women. A lot of times you'll hear people say that it only affects men, but that's not true. Women can get as well. It's not as common, it's usually not as severe either. These are great people to go clothes shopping with. come out of the dressing room, yeah, that looks great. They don't know. How do we test for this? Have you ever seen the test for color blindness? The dots test, yeah, there's a whole bunch of dots, usually in a circular pattern, and within that pattern, these color dots, there is a number or a letter or an object or something of contrasting color dots. It's called the Ishihara test. And so if a person is colorblind, it just, all the dots will seem to appear as the same color. They can't make out the figure or the number or whatever. Okay, kind of interesting, maybe not. Yellow tint to the conjunctiva, called scleroicterus. That is an abundance of buildup of unconjugated bilirubin. And where does bilirubin get conjugated? In the liver. That's just a good default answer. If you're not sure where something happens, the liver is a pretty good default, because the liver does over 500 different things, especially when it comes to enzyme conversion or breaking down or something like that. You've probably heard of rapid eye movement during sleep, the final stage, then the deepest sleep. Pupils equal, reactive to light, and accommodating. You'll see that. Pupils equal, reactive to light, and accommodating. That looks like a cataract. That's some conjunctiva, conjunctivitis. What is this? Herpes and eye disorders. Oh, herpes! Not just for breakfast anymore. Herpes, this is dangerous. When it starts infecting around the eye, it can lead to blindness. So we always get a little concerned when you see something like this.
It would be more common in an immunocompromised patient, right?
Yes. Anytime you see herpes in some place where you don't expect to see herpes, it's always more likely in immunocompromised children and immunocompromised. It's actually, did I tell you this before? It's actually the leading type of encephalitis. Herpes simplex is actually the leading type of encephalitis. A lot of people think it's like West Nile virus or something like that, or cytomegalovirus. No, it's actually herpes. Nobody cares. Otitis media, okay. Infection of the inner ear. Otitis externa. No, not inner ear, middle ear. That is wrong. Wrong, wrong, wrong. Labyrinthitis, inflammation of the inner ear. That's correct. Meniere's disease, chronic infection that affects the labyrinth, leads to progressive hearing loss and vertigo. This can also be caused by trauma that seems to Meniere's disease, that's how it's pronounced. But you'll hear about this. I guarantee you'll see labyrinthitis, without a doubt. So when you think of labyrinthitis, think of that whole part inside the inner ear. Heart snail, heart crazy looking tubes. Wacky, crazy tube, inflatable guy. Deafness, we talked about that. Tinnitus, ring in the ear. Good point here. Aspirin, very, very common side effect of aspirin or too much aspirin is tinnitus. So your patients who are on their aspirin-a-day therapy, you'll often have them complaining about the ringing or buzzing sound in their ears. Too much aspirin. A 22-year-old carpenter complains of left eye pain after using a power sander without eye protection. It's a mystery. That's one for Dr. House.
That's a good good workman's comp declined claim.
No, the safety's gonna improve the iron safety glasses.
Right, that's why,
E9.
that's why it's a declined claim.
Or he drilled holes in ventilation.
Oh my god. Yeah. In the shop I used to work in, we had a guy who'd been there for 20 years. He was the only one that we couldn't get to wear safety glasses. And had to go as far as to threaten firing him. He wore them for a week. And then stopped.
Can we take a break before we start endocrine?